you check out my page bio. You can, for more information, you can check out my page bio. It's on my front page. Today we have a special case. He is suffering from sleep disc. He is suffering from sleep disc. Sleep disc is a condition whereby this space is reduced. This space is reduced, and intervertebral disc is thinning and damaged. Sleep disc or herniated disc with protrusion, and he has an attack. Therefore, I'm going to do treatment, I'm going to do diagnosis, I'm going to do muscle test. Hari ni kita ada special case sakit belakang disebabkan oleh sleep disc ataupun herniated disc. Kes-kes sakit belakang yang teruk ataupun susah nak jalan, tak boleh bangun, tak perlu buat surgery. Rawatan natural boleh selamatkan. Jom. Halo abang, take a seat. Sakit belakang teruk dalam ini 3 hari.
Yeah.
Alright. Tangan depan. Okay. Okay. Kita buat muscle test dulu ya. Okay, sekarang bongkok ke depan. Bongkok. Ada rasa apa-apa tak? Lagi sikit. Rasa tarik ke, lengur ke, sakit? Kepas. Sakit dekat A, B atau C. Okay, so as you bend forward, there is pain in the lumbar region. Naik. Okay, sekarang bend to your left. Ada rasa tarik ke? Tarik. Tarik ke kiri, tengah, kanan. Right. So there's pulling in the quadratus lumborum. Okay, sekarang kanan. Sakit ke tarik? Tarik dekat kiri, tengah, kanan. Kiri sini ya. Right. So there's a pull. Okay, rasa tarik dekat sini dan sini. Betul tak? Alright, so there's a pull in quadratus lumborum, QL. Okay, sekarang melentik ke belakang. Tak ada masalah. Tak ada. Alright, sekarang baring pandang atas. Baring pandang atas. Okay, tadi test itu untuk test you punya otot. To check which otot, which muscle is healthy, which muscle is not healthy. And now we're going to do herniated disc test or sleep disc test. Relax. Belakang abang relax. Relax, let go, let go. Let go, lepas. Lepas. Jangan takut. Saya tak cium you. Relax ha. Okay. Relax abang, relax. Okay. Alright. Straight leg test. Belakang terasa apa-apa tak? Tarik ke, lengur ke? Ada rasa? Sikit. Sikit belakang sini kan?
Yeah.
Right. Betul. Kalau peha itu bukan. Kalau sini sejam sedikit tarik ke atas selesa. Okay. When I do straight leg test, right now the focus is to feel any tenderness ataupun tak selesa dekat punggung, pinggul, pantat ataupun pinggang. So if there's a pull or discomfort, that means there is herniated disc or the disc space is reduced. Now I'm going to do this side. Ada rasa apa-apa tak? Sini tak ada, right? Alright. Now the raise is up to 60 degree. Remember, it's up to 60 degree. Now if it's higher than 60 degree, that's SI joint issue. Problem with SI joint. To test lumbar sleep disc, it's 60 degree. So itu beza lah. 60 darjah untuk test sleep disc dekat bahagian lumbar. Alright, where's my spine? Okay. Okay, tadi test itu untuk test bahagian lumbar. Right. Straight leg test is to test the lumbar region to check whether the intervertebral disc is thinning or normal. Kalau ini nipis, belakang ada rasa tak selesa lah. Right. Anything above 60 degree straight leg raise, that is to test SI joint. SI joint. Okay. Lepas rawatan kita test macam mana boleh? Okay, menyarap. Alright, first we're gonna start off with deep tissue massage. Boleh? Nanti saya buat saya terang lah, ha. You jangan takut, ha. Okay. Turun sedikit. Alright, we're going to ease up the tension in the lumbar because of suspected slip disc or herniated disc with protrusion. A few drops of oil. Naik sikit, abang. Using your palm. Ada rasa apa-apa tak? Ketat ataupun sakit? Sakit? Okay. As I push with firm pressure, he feels pain, pressure. Pain because high tension in the lumbar region. And spinous process is too near to each other. Spinal process too near to each other. That means that this space is reduced. Sebab jarak di antara tulang tu dekat, oleh tu saya tolak, abang rasa macam tak selesa. Huh? Yeah. How's it? Yeah. Okay, I'm doing now. Yeah. Okay. Okay tak abang? Saya tolak you. So I'm just checking in whether my pressure is too much or too soft. It has to be firm pressure. Kadang saya kena kuat tapi tak boleh kuat sangat. Boleh tak abang? Okay, now as I push, softer. Ada rasa lebih lembut tak sekarang? Ha? Tadi saya tekan, you rasa macam tangkap macam tu kan? Okay, his feedback is his back is softer and more nimble. Okay, now we're going to work on quadratus lumborum. The deep tissue for quadratus lumborum, QL. Okay, apa yang saya tekan, saya terang kepada you lah. Now, pressure down. Quadratus lumborum. Firm pressure. Slide lateral, medial, lateral, medial, lateral, medial. That's it. Now the other side. Quadratus lumborum. Now this is to ease up muscle contraction. Otot dah tangkap abang. Tangkap, that's why. Right, firm pressure. Slide. This is skin slide. Skin slide. Skin slide, left and right. Medial, lateral, medial, lateral, medial. Very good. Okay, now that we are done. Okay, continue. Right. Okay. Because there's pressure in the lumbar region, therefore, we're going to remove pressure. How do we remove pressure? Ease up pressure, reduce tension is to do spinal adjustment, cervical, thoracic, lumbar, sacrum. Sebab sini tegang kan? Sebab tekanan seluruh belakang tu tinggi. Lepas itu saya kena buat sini juga. Boleh ya bang? Boleh. Right. Cervical adjustment. Wrap on the scapula. Rotate. Traction, traction, traction until he feels the tension. Okay, banyak bunyi. Right, wrap. Contact on levator scapula. Rotate. A bit of chin up. Rotate, traction until maximum and short impact. All right. Thoracic adjustment. Blade technique on transverse process. Skin slide. Nafas. Hembus. Wow. Downward pressure. Downward impact. Nafas. Hembus. Superior to inferior. Nafas. Hembus. Straight down. PSIS 3, 2, 1. PSIS. Okay, now we do a bit of mobilization. Right, press contact on sacrum. Via mobilization. Right, leg extension, hip extension. Very good. Oh, this is tight. Hip mobilization, leg mobilization. Right, contact on sacrum. Right, this one can ease up pressure and muscle contraction. Alright, okay, pusing badan, pandang atas. Okay. Now a bit of mobilization. This is for lumbar region. Ooh, look at that, look at that. Look at that, okay, look at the tension. Okay, kenapa sakit belakang? Sebab otot you dah mengecut dan kekejangan. Look at that. Okay, muscle contraction. Keep your mobilization. This is gluteus medius, gluteus maximus, and quadratus lumborum. Okay, mobilization for left hip, left pelvis, and lumbar region. This one not so tight. L-shaped mobilization. Gonna rock forward, backward, superior, inferior, superior, inferior, and short impact. Okay, good. We're gonna do. You can do C7 T1 adjustment. C7 T1 adjustment. Right side bending, wrap. Side bending. Line of drive, 45-degree downward. Come on, relax, relax. That's it. Side bending. Oh, dengar tak? Ini tulang dekat bawah. Right. Now, abang relax, relax, relax. Cervical C5, C6, C5, C6, C7 adjustment. Rotate, neck flexion. Index on C6. Index on C6. All right. Okay, up. Okay, bangun. Berdiri. Sekarang test forward bending. Bend forward. Slow, slow. Macam mana? Okay? He said okay. Up, side bending. Oh, lebih jauh kan? Right. Range of motion is much better. Right bending. You can notice range of motion improve a lot. Belakang tak ada sakit kan tadi? Tak ada cuba? Or you can go lower because muscle contraction reduce. Baring. Pandang atas. Now we're going to do the straight leg test to identify herniated disc or slip disc. Akan rasa apa-apa tak? Right, according to him, no more tenderness, no more discomfort in the lumbar region, sacrum region. This one. Okay? His feedback is okay. Tak boleh naik, tak boleh tinggi sangat. Tinggi sangat untuk SI joint. Tak sama. Alright. Happy? Happy? Thumbs up? Yeah, okay, good. Now, we're going to improve blood circulation. Kita nak meningkatkan pengaliran darah untuk belakang. Okay, jom. Menyara abang. Tadi ingat tak saya buka ini ray. Ya, ini untuk belakang. Alright. Ray in the lumbar region because of suspected slip disc or herniated disc with protrusion. Now this is L4, L5. L4, L5. L4, L5. Right, that's about it. L4, L5. This is sacrum. This is thoracic. One more needle to go. All right, now let's do thumbnail. 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 Thumbnail, I thought it's a landscape. Okay, all right. One more again. Thumbnail. Okay, that's all for today. Kalau apa persoalan boleh komen di sini. If you have any questions, you can comment down below, or you can just WhatsApp us or check out my page bio. Boleh kunjungi page bio saya. Okay tak abang rawatan hari ini? Okay.